Yeah, so my project is on culture and COVID-19. And my name is Anit, and my mentor is Alex Raghunandan. And I chose this topic because I enjoyed learning about viruses and immunology in my anatomy class, and I live around San Jose in California. So, yeah, my project explores the connection between culture, pandemic prevention practices, and specifically the COVID-19 pandemic, because all across the world, countries enacted like all these different policies. And these policies were shaped by like political landscape, ideal, and culture. And my goal is to find which one succeeded and why they were effective. So starting off with North America, so I mainly chose to look at the US for this section. And the US did not have a very good response. So to start off with some strengths, it used a lot of money to fund vaccine development, which resulted in a vaccine eventually. And it was able to issue significant economic stimulus to stop the economy from getting worse. But some of the weaknesses were that political divisions made like public health mandates partisan issues, which stopped the nation from being completely unified in its response. And the individualistic values clashed with the mandates, which led to a lot of non-compliance. And additionally, the privatized healthcare system did not allow everyone to access care, which hurt vulnerable communities more, and that helped with the spread of COVID. So, if you look at the graph, you can see how number of active cases started in 2020, and there's a huge spike in 2022, which slowly recedes. And most countries follow this trend with starting in 2020 with a spike in 2022. But the difference is the actual number of infected cases. As you can see, it goes like all the way up like to almost 20 million cases, which is the highest in the world. To look at Europe, um, it had a lot more coordinated response and more social safety nets. So universal healthcare ensured widespread access to testing and treatment, and this helped slow the spread of COVID. Social welfare programs protected jobs and stabilized the economy, and a cultural emphasis on collective responsibility made people agree with the public health mandates more, which helped stop the spread of COVID even more. And some of the weaknesses were the bureaucracy and different rules across different EU member states led to different responses in vaccine distribution, travel rules, and border laws, which caused a lot of chaos, and that chaos led to more COVID spread. And the universal healthcare, while it did allow more access to healthcare for more vulnerable communities, it led to some shortages in medical equipment that did lead to some more deaths. And if you look at the graph for active COVID cases, specifically in the UK, you can see it kind of has a similar shape to the US graph, except the numbers are a lot smaller. While the US one was bordering near 20 million cases, this one is going near 5 million cases. And part of that is because obviously the UK has a lower population than the US, but the universal healthcare system helped a lot with this as well. And so I specifically tried to focus on China for the Asia section because I thought that their response was the most unique. The response was very authoritarian, and their goal immediately was to completely eliminate the spread of COVID. So the authoritarian power that they had allowed for like extremely fast lockdowns and the mobilization of the mandatory PCR testing regime. And part of this was the Fangcheng camps that were created that were like temporary hospitals that helped with quarantine. And initially, the death and case counts were extremely low, which is, and China's where COVID-19 originated, which makes this unprecedented. And this allowed for long periods of domestic normalcy. And the strategy was very harsh, and it came at a high cost to personal freedom and human rights. And additionally, it even damaged the economy significantly because of how uncompromising the lockdown was. And it started extremely fast, so people had very little time to prepare for it. And just as fast as it started, it ended extremely fast. And people did not have widespread immunity or vaccination yet, which led to a massive wave of infection and death after it ended. So as you can see, the graph for this looks very different from the other graphs. It starts with a big spike in 2020 due to being the point of origin, but after that, it almost borders closer to zero than 25,000. And like other countries, it had a spike in 2022. But the most significant part about this graph is how in 2023, it spiked massively. And while the numbers are extremely low, only like close to 125K compared to the US's 20 million, I think it was interesting how the graphs are so different. And you see it's almost a straight line until 2024. South America had federal denialism, which severely impacted the response. So some of the strengths were the emergency cash transfer program that the government implemented, which helped many poor citizens access healthcare. But and another strength was that individual state governors and healthcare workers made efforts to implement protective measures and care for patients despite federal support, which means that individual parts of Brazil tried very hard to stop the COVID spread by themselves. So the main weakness of specifically Brazil's uh, response was that the government had denied a lot of the COVID related things. So it led to conflicting policies between the national government and states, which led to a lot of confusion and chaos. And the universal healthcare system, or SUS, was underfunded and overwhelmed, which led to shortages of basic supplies like oxygen. And a lot of hospital systems in major cities actually collapsed due to the stress. And political leadership sowed public distrust in vaccines, undermining the country's legacy of successful immunization campaigns. And this public distrust also made COVID a lot worse in marginalized areas. And this inequality and crowded living conditions combined made social distancing very hard for many people. So COVID spread like a wildfire through those areas. And in conclusion, populations that adhered to government safety mandates were less affected by COVID-19. But whenever politics interfered with these mandates, it always caused polarization that caused even more COVID cases and deaths. And one more thing I found is that universal healthcare systems were generally more effective than private ones at stopping COVID spread due to their accessibility in marginalized communities, and which is where COVID spread is more likely. All right, thank you.
Awesome. Thank you so much, Anit. There was a couple questions that came in too for you, so we'll just ask those now. So you presented on South America, China, UK, US. Which pandemic response do you think worked best? And could it work in a completely different country as well? Why or why not?
Yeah, I think that out of the ones I covered, probably specifically the UK had the best response because it was kind of like a middle ground between China's response, which was completely authoritarian, and the US's response, which is like very delayed and kind of polarized. And while it has more deaths than the China version, the damage to the economy and everything else was like very unmanageable. And I don't think that China's authoritarian response would have worked in any other country due to their government. So, yeah. And the European like response, I don't think it would also work in every country because some countries are more authoritarian than others, but I think that it could work in a lot of different countries.
Okay, awesome. Thank you. The other question we received from the audience was, did you find any examples where a country's culture made it harder to follow health recommendations?
Yeah, in many like European countries, uh, like uh, kissing the side of someone's cheek is like a common greeting.
Mhm.
So countries with that greeting were more affected by COVID. And like one counterexample is in Japan, like bowing is more common than handshakes, or not more common, but it's like more likely to happen than handshakes. So Japan was able to adjust really easily, and because of that, they had lower spread.
Awesome. That's really, yeah, I didn't think about that. That's a really good point.
Yeah.
And then the last question we had for you was, besides just counting infections, what other ways might different countries measure whether their pandemic response was successful?
Well, other than infections, obviously the actual fallout of the response is important. Like you could argue that China's response was very successful due to them having like a low death count, but the damage to the economy and human rights, like that was a lot more than other countries. So I think you have to look at the fallout to really determine how effective it is, specifically like economic fallout and cultural fallout.
Awesome. Thank you so much, Anit. This was so great. We appreciate you coming in and sharing all about this. I definitely learned a lot more than I thought that I knew about COVID. So thank you so much. All right, everybody, give it up for Anit.